Hello, and welcome to Corporate Lactation Services 5 Milk Moments. My name is Melinda Gutierrez, and I'm a registered nurse and international board certified lactation consultant. Today, I will be discussing breastfeeding and safe infant sleep. Infants have many benefits when they breastfeed or even feed with breast milk via bottle. Infants who are breastfed have a lowered risk of asthma, obesity, type 1 diabetes, severe lower respiratory disease, ear infections, diarrhea and or vomiting, necrotizing enterocolitis for preterm infants, and sudden infant death syndrome. So what is SIDS, sudden infant death syndrome? It is a sudden unexpected death of a baby. Usually the baby is younger than 1 year of age. It happens when the baby is asleep or it happens in the baby's sleep area. Ways that breastfeeding helps to protect against SIDS is that breastfeeding babies, they usually arouse very frequently to feed. The mother is going to have more contact and touching during these feeds. So SIDS has a few triggers as well that research has shown, such as respiratory, ear, and diarrhea infections. And remember what I discussed earlier is, those things are also decreased when the infant is breastfed. So exclusive breastfeeding for at least 6 months offers the most protection, but any breastfeeding for at least 2 months helps to reduce the risk of SIDS by 50% during infancy. So the American Academy of Pediatrics does have some recommendations on safe sleep and what the environment should look like. For the first 6 months of life, they do recommend that the baby shares a room with their parents or with the mother, and the baby is only brought into the bed to feed or to comfort. If the mother falls asleep with the infant in the bed and she awakens, the baby should be placed back to his or her own bed on his back, of course. Bed sharing is never recommended for babies if they're less than 4 months of age, if they're born prematurely or with low birth weight. If you or anyone in the bed is a smoker, especially if the mother smoked during pregnancy, if you've taken any medication or drugs that might make it more difficult for you to awaken, you drink any alcohol. Also, if your bed is very soft, such as a water bed, an old mattress, or if you're sleeping on the couch, a sofa or armchair, those are all very unsafe environments for the baby. You should try to avoid any pillows or blankets also on the bed. It is recommended to offer a pacifier to the baby, of course, once breastfeeding is well established. And you can offer that during nap time or at bedtime, and that will help decrease the risk of SIDS. So if you can see in this picture, this baby is placed on his or her back. There's no blankets, no pillows around the baby. Nothing is covering the baby's head or face. The baby is sleeping on a firm mattress as well. And you want to make sure that the crib is not placed to any windows where there would be any cords or many blinds or any other hazards close to the baby. So some mothers that are exclusively breastfeeding the baby do prefer to co-sleep or bed share with the baby. This helps to enhance their sleep. It limits interruptions during their feedings. So naturally, mothers tend to sleep facing the baby. They call this the cuddle curl, which is nature's way to help protect the infant. So the mother is facing the baby. Baby is placed on his or her back. Usually the baby's face is aligned with the mother's breast. And the mother automatically flexes her knees up towards the baby and puts her arm underneath her head or places her arm around the baby. And this helps to prevent the baby from moving up or down into the bed and creates a safe environment so the mother is protecting the baby while they sleep. So the La Leche League does promote 7 criteria to help the reduce of SIDS while the mother is bed sharing with her infant. This is called the Safe Sleep 7. And they recommend, of course, that the mother is a non-smoker, that she is sober and unimpaired, so she's not taking any medications or drinking. The breastfeeding mother and the baby should be healthy and full term. The baby should be placed on his or her back, lightly dressed, and on a safe surface, which we discussed. And some pretty nice pictures there. Here are my references. And I just want to thank you so much for joining us today. Please visit our website at corporatelactation.com. You can see additional information on a variety of topics, as well as a registration link to attend our Baby Steps Cafe, which is our mother-to-mother support group. This is held every Wednesday at 2 p.m. Eastern Time. And thank you so much for allowing us to support you throughout your breastfeeding journey.